PanWorks, bringing ethics to life.
Well, it's great to see you all today, Joanne and William and everybody, Bernardo and Rob, and I'm glad my husband Lawrence was able to call me. Yes, I'm actually right now speaking to you from Bwindi Impenetrable National Park, and we're right now in our Gorilla Health and Community Conservation Center field lab. And I've been working with mountain gorillas for 30 years, actually, starting out in 1996 as the first wildlife vet in Uganda. And later on, I got to do so many other things, which I'm going to talk about in the presentation. But today, we went to the gorillas and visited a group. And there's one of the youngest babies who was born in late December, so he's 4 months old. And it was just nice to be with the gorillas again. It always gives me a lot of energy. Because of our unique approach to conservation, where we developed a One Health approach when people made gorillas sick, we have received several awards, and it's been a really great honor. I first got to hear about the mountain gorillas when I was setting up the wildlife club in my high school in Uganda. A warden came into the park and said, "We have mountain gorillas in Uganda." I was around 17 years old and I was about to start high school. I'd finished middle school. And I was in my vacation. In Uganda, it's called O-level going to A-level. This was 1987. He said, "You can't see them. They've not yet been habituated for tourism." And how did they find out? They were going through the forest and they came across night nests in this forest. And they took the DNA from the dung samples. They shared it with people in California who were already doing genetic studies on mountain gorillas. And they found that they were exact the same as the mountain gorillas in the Virungas. So you can imagine at one point, these two forests were connected. This was over 100 years, actually over 500 years ago, they may have been connected. But so they'll never connect again because there's been a lot of roadworks and buildings and constructions. So sadly, these two populations may never meet. But it was going to take a while before I was able to visit the mountain gorillas. So when I went to vet school in London, I was able to come back and work with captive chimpanzees in Entebbe Zoo, which were victims of the bushmeat trade because you're allowed to work with animals of your choice. And I got to understand how bad the bushmeat trade was and how it was affecting, not only conservation, but welfare, because these chimpanzees loved to escape from the cages when you weren't looking, and they wanted to be carried back in because they missed their mothers. The mothers would be eaten across the border in DRC. The babies were too small to eat, so they'll try and sell them across the border. Then I got to study wild chimpanzees a year later with Professor Vernon Reynolds in Budongo Forest. And that was really exciting because then I realized you could actually study animals that are not captive. And this photograph was taken when 2 years later I got to go to Bwindi, when the mountain gorillas were habituated, and Dr. Liz McPhee organized for me to start studying the gorillas in Bwindi in 1994. And this photograph was actually taken when I went to the waterfall walk because I had a nasty cold as soon as I arrived and I wasn't able to go to the gorillas. But when I was finally able to meet them, this particular gorilla is called Kachipira. He was called Kachipira because when they were habituating them, he had a broken hand. We only saw one gorilla that day, but it was really amazing to see him because he was so accommodating. And it made me realize how close we can get to them, how vulnerable they can be. We're 5 meters at that time, and how easily we can make them sick. And I also saw how that it was such a hard age to get to the gorillas. And I thought to myself, why don't I become a full-time wildlife vet instead of becoming a vet who also works with wildlife? So this was a big turning point in my life. I looked at parasites in the fecal samples of the gorillas and bacteria, and I found that the two gorilla groups visited by tourists had a higher parasite burden than the one gorilla group visited by researchers. And this made me think, oh, tourism could be having a negative effect on the gorillas. Maybe they're stressed and they have a higher parasite burden and they're actually picking up human parasites. But I also saw how much tourism was helping because most of the rangers used to be poachers and tourism was giving them jobs. They were hired to look after the gorillas. They were hired in the lodges. And so it was a very good lesson in conservation medicine for me as a vet student. So I convinced Dr. Edroma, who was heading the national parks, that he needs to hire me as a first vet. And this is what a wildlife vet does. When I shared my reports, and I was hired. So that was amazing. But as soon as I was hired, when I finished vet school in 1995, I came to Uganda and nobody used to touch animals. So we quickly learned that it has to be either when it's human-related or life-threatening. We followed the rules that were going on, that Mountain Gorilla Vet Project in Rwanda was using, the guidelines, that yes, we shouldn't interfere with nature. If two gorillas are fighting, maybe it's time for the stronger one to take over, so you have new genes in the population. And so I learned a lot from the biologists around me, and that really helped to build my conservation knowledge as a vet who had been trained to only deal with animal welfare. But one of the first cases I had to deal with was a scabies outbreak. They told me they were losing hair and developing white scaly skin. So Dr. Richard Koch from Kenya happened to be in Uganda to try and help me to develop veterinary needs. And the World Bank was going to fund that, veterinary needs for the Wildlife Authority, officially, so that we could be included in the budget. So I said to him, could you please come to Bwindi and help me with the case before we go around to visit other national parks? So he came over to Bwindi, and it was very useful to have him there because Dr. Liz McPhee, who had given me my first opportunity, was not feeling well that day. So we went to the gorillas with Richard, and he had seen the same case in cheetahs in Masai Mara. And though the cheetahs visited by very many tour vehicles had scabies, and those that were not didn't. And this particular group was down to 4 gorillas with 6 tourists. So we took samples. It was even scratching under the ketamine anesthetic. So it was a very severe infection. We took samples, but sadly the baby gorilla was dropped the next day because the mother wouldn't allow us near her on the first day. And the baby gorilla, normally gorillas will hold on to a baby until it starts rotting, but she had so tired of seeing her sick baby that she just dropped the baby. So we were able to do a fresh post-mortem. The mites were still alive when the baby had died. The baby did die of scabies and secondary pneumonia, and this made us start thinking, where could this have come from? We had other cases like rectal prolapses in the gorillas, and we didn't know whether maybe they picked up a human parasite, which then led the gorillas to, strain to defecate. And anyway, I operated on Kahara. She got better, and everybody was happy that she got better, even if they were not sure it was human related. And so this is what happens at Bwindi. As you're driving, increasingly the gorilla habitat is being cut and surrounded by banana plants. So gorillas come out of the forest when they lose their fear of people. They come across dirty clothing on scarecrows, and then they start to, raid crops. And so this is exactly what happened. They started eating people's banana plants. In fact, we're about to do a study to find out, why do they go for banana plants? Are they looking for sugar? Is it because there've been wild bananas in the forest before and all these kind of things? Is it due to climate change? But at the time, we know that they would come out because they've been habituated for tourism. They've lost their fear of people and people putting out dirty clothing on scarecrows. And that's how they ended up picking up scabies. So this human-wildlife conflict is a big source of conflict for the communities, but also leads to disease transmission to the critically endangered great apes. So that's when my One Health journey began, because I realized you couldn't keep the gorillas healthy without improving the health of their human neighbors. So everybody turned to me at one point and said, the gorillas have picked up scabies. They may pick up other diseases. There's open defecation. People are not covering their rubbish heaps. And me being the only vet in the organization, they wanted me to support them in having health education workshops. So that was another turning point in my life. I went to Kampala and got a designer to make some nice brochures in English and the local language. We visited 1,000 people in 8 villages where gorillas were always coming out. And that was my first time to be exposed to participatory rural appraisal techniques. I went with the community conservation warden and ranger and the sub-county health assistant. It was a One Health team, although it wasn't called One Health. It was very interesting because we told them how the gorillas got sick. And I was about to tell them how we can prevent this. And the ranger touched my hand and said, let's hear what they have to say. They came up with much better suggestions than I had. They wanted health services to be brought closer. I didn't realize that when someone falls sick, they carry them up these very steep hills to the top of the hill, and they may not even make it to the hospital when they're still alive. They also wanted to support the community volunteers who had gorillas away from community land with raincoats and gumboots. And they also wanted us to continue with the health education. These little boys were supposed to be in school, but they were herding goats in the garden. And as long as such things happen, the gorillas are always going to be compromised, and so are the people. Shortly after that, I got an opportunity to do a zoo medicine residency at NC State and North Carolina Zoo. And my master's research looked at TB at the Human Wildlife Livestock Interface in Uganda, looking at TB in buffalo, cattle, and people, and also looking at TB in people going close to gorillas. This was, of course, North Carolina Zoo, and this was Queen Elizabeth National Park. But then I understood that tuberculosis system, community-based dots, where they're watching you taking your medication every day for 8 months, was working at Queen Elizabeth National Park, but not working at Bwindi, because 2 people died during my study at Bwindi who could have recovered, and 1 person recovered at Queen Elizabeth because CB dots was there. And so we thought, let's start an NGO that addresses these issues. And we started CTPH in 2003 when I finished the residency program. Actually, in my last year of the residency program, we registered it as a nonprofit in North Carolina, together with my husband, Lawrence, and Stephen Rubanga, a vet technician working with the Ministry of Agriculture, and was helping me with the research. So this is what happens at Bwindi. It's a very hard edge. The threats to gorillas continue to be habitat loss. Poaching is a big issue. Not so much of gorillas, but other animals in the forest, like the duiker or bush pig, and they get trapped in snares. But if they cross over to DRC, they can get eaten because they believe that if you eat a gorilla, you can be as strong as a gorilla. Whereas in Uganda, the hunter-gatherers who lived in the park, the Batwa, believed that it was bad luck to look in the eyes of a gorilla. So this is one of my favorite gorillas, Kanyonyi. He was born the year that I started working in the Wildlife Authority, and he got so used to people that when he became a big silverback, he would scare tourists to see their reaction. We started CTPH then in 2003, and inside this forest, you don't only have gorillas, but you have elephants, chimpanzees, 4 species of monkeys, over 300 species of birds, 200 species of butterfly, pangolin, duiker, bush pig, and it's a very important water catchment area and climate modulator. I'm actually looking at this view right now as I'm giving you the presentation. It's an incredible view. We have 3 integrated programs. We have wildlife conservation with the focus on gorilla health and wildlife disease surveillance, community health with the focus on One Health, mainly looking at diseases that can spread between people, gorillas, and other wildlife and livestock, and other issues that affect conservation and public health. And then alternative livelihoods is a program we began in 2015. Actually, we had it before, but we started the coffee. And Lawrence came up with the idea of starting a global coffee brand because whenever you're going to visit gorillas, you often cross coffee farms. And these farmers weren't getting a fair market or steady price. They're still entering the forest to poach. We train the rangers to monitor the health of the gorillas. So every month, every gorilla group has a fecal sample collected, every individual that's habituated, and also when it's abnormal. And we analyze it at a Gorilla Health and Community Conservation Center. This was our first temporary one, built with support from the MacArthur Foundation. And this is the US ambassador visiting when we're getting our first funding from USAID through African Wildlife Foundation. This is Stephen giving them a presentation. And then later we got funding from TASC, and these are students from Royal Vet College, my alma mater, and University of Dublin, looking at entamoeba and stress in the gorillas, and Stephen was training them. Gorillas are always eating eucalyptus trees because they like the salt, maybe, but also people are asked to plant them so they don't have to go into the forest to poach. And gorillas are also sharing water sources with people. So it's a big potential for waterborne pathogens like Giardia. This is a microhydro dam that was put up by GIZ when we advocated to UNIDO to bring electricity in this area, something Lawrence really followed up on. And then over here, we had one of our first public health staff, Joseph Bienanebie. He found out that the cattle, the people were all defecating in the same water source that the gorillas were crossing through. So we started a study to look at Giardia in the gorillas. And we did Giardia and Cryptosporidia, and we did find that the areas where we had more community health and conservation volunteers, there was less Giardia and less Cryptosporidia. And we felt that improving their public health of the community was reducing the risks to the gorillas. So we train community conservation animal health workers, and they were the ones who we worked with to collect these samples. This is a student from UC Davis who managed to get fecal antigen ELISA kits for free and were able to do this study, which was published in Frontiers for Public Health. And over here, we found that, that the two Giardia in this particular study we did not find, but we found Cryptosporidia. And the areas where we found crypto, we recruited another village health and conservation team member, and we educated the cattle keepers not to defecate in the water and to dig cattle water troughs, because we found Giardia in people and livestock and crypto in people, gorillas, and livestock. So this is something that happens a lot. Gorillas are always going outside the park. And so what we do is we work with gorilla guardians to also collect samples from gorillas when they're outside the park. And we also work with village health and conservation teams. We train them all. And these are village health teams or community health workers who we train to do conservation work. So they tell people about good health and hygiene, sanitation practices, such as, you have to drink clean water so you don't pick up diseases like Giardia and Cryptosporidia. They talk about family planning. They talk about having a hand washing station outside the toilet. They talk to them about, how to access tourism revenue, how to have a food crop garden so you don't have to enter the forest to poach. They also encourage them to have a cash crop and to plant trees. And that's going really well. In 2007, we trained 26 of them. And Dr. Lynn Gaffikin, who's a public health expert, helped to set up our family planning program. USAID asked her to help us. They gave us additional funding to start family planning, something they used to call population health environments. And now, as I speak, we have 430 of them, reaching over 50,000 people in over 10,000 homes. And they're able to give talks to the community. This lady is speaking to her community, Hope. So when we added family planning, it was something that I was reluctant to do because I was mainly focusing on preventing zoonotic disease, which is really what vets are more interested in. But I found that we're not only protecting the gorillas, we're protecting their habitat. It's not enough to protect the gorillas, you also have to protect their habitat. And family planning was a very good way because people would enter the forest to poach, collect firewood because they had to feed a large family. And so we really got into family planning, and it's been one of our most successful programs. And so we have the bad family that does everything wrong with too many kids, and then the good family that has 4 kids. And when the gorillas come out, instead of herding them themselves, they call out the human gorilla conflict team. People don't get hurt. The family with 4 children, they all go to school. They end up, the boy becomes a ranger, the girl becomes a nurse, and they're able to break the poverty cycle. And this really has changed people a lot. The most popular contraceptive was the injection. And so we teamed up with Family Health International, and we're one of their pilot sites. And this led to a policy change in the health sector in Uganda and beyond, which is very exciting. Because now lay community workers can give injections, and they took it to Kenya and other countries as well. We started to sustain them with group livelihood projects, like some of them wanted goats or cows. And Stephen, our third founder member, said, instead of giving them an individual goat, an individual cow, which they may not look after properly, let's make it a group activity which brings them together. And so we did. And when we made it a group activity, we've not had dropouts for the past 18, 19 years, which we're very happy about. And when CARE came along, promoting village saving and loan associations, they put our logo on their passbook without our permission. It's okay. And they've just kept going, and it's amazing. Just a month ago, I was checking out they were busy giving out money in a VSLA, and it's just one of those programs that a lot of community health workers drop out, but ours haven't. And I think it's because we were able to give them group livelihood projects very early on. And we're continuing to get support from other group donors like Population Connection, and they're continuing even without donor funding. In between donor funding cycles, this particular intervention keeps continuing because women don't want to have babies every year. They want to do something else with their lives, and the men realize that it's helping them to balance the family budget. So we're very excited about this. The family planning rate where we are went up 3 times, from 20% to 60%, higher than the increase in rural areas from 30 to 45%. We also did a similar program in Democratic Republic of Congo, where the other gorillas are found, mountain gorillas and eastern lowland, And although it's a largely Catholic country, people are really embracing family planning, and they're much poorer, but they're really embracing what we can do for them. So some of the research studies that have led to policy change, we advocated to the government to set up a national One Health platform and a national population health and environment network. And this is a master's student from Oxford Brookes University who interviewed tourists in 2010 to see if they're willing to put on face masks, which they were willing to do increasingly. So by the time the pandemic came along, this became a national policy. We're pleased that the mountain gorilla population is continuing to grow. When I first started working with them in 1996, I participated in the census. We counted 300 gorillas in Bwindi to add to the 350 in Virunga to make 650. So suddenly the mountain gorilla numbers jumped from 254 to 650, not because they had increased, but because a new population had been discovered. And steadily the numbers have continued to grow. The last census was carried out in 2018, where we counted 459 in Bwindi to add to 604 in Virunga to make 1,063. Last year, another census was carried out in Bwindi. We're getting the results this year. Our team we enjoyed being part of that census. The Virunga one was postponed because there's insecurity, but in 2018, mountain gorillas were lifted from critically endangered to endangered. And we're pleased that so many efforts are contributing to this: veterinary efforts, One Health efforts, improved tourism, improved benefits to the community. And now how do we sustain these efforts? Some of it is through Gorilla Conservation Coffee. It's a global coffee brand that we started, and it's really improving people's livelihoods. So we have, this coffee was named after my favorite gorilla, Kanyonyi, who I mentioned at the beginning of the presentation. And we felt that by putting a gorilla that everybody knows, because now everybody knew Kanyonyi, he liked to frighten tourists to see their reaction. It's a very naughty silverback. We felt that they would know that this gorilla is from Bwindi, it's helping farmers around Bwindi, and it's traceable. It's earned 92 points in coffee reviews, so it's very good coffee, and it's being sold in not only Uganda, but Kenya, USA, New Zealand, Australia, and the UK. Gorilla tourism is the main activity that is a premier activity in East Africa. And over here, this was pre-COVID days, 2011. People were 7 meters away, as they were told to be, and it was good. But we found out that when we did a study with students in Ohio University, it was rarely the case. 98% of the time, people got too close to gorillas, closer than 3 meters. 60% of the time, people got too close. 40% of the time, the gorillas broke the rules. And so when COVID came along, we're like, everyone has to put on masks. We have to improve, be stricter on distancing, hand hygiene, the same messages they did to prevent COVID between people. And so this was a pivotal moment where the Wildlife Authority agreed that everyone should wear masks when they visit the gorillas. And the research that we had done in the past helped to build up upon this. And so not only through education, but we tested the gorillas, and luckily, as far as we know, none of them picked up COVID, because we feel that the fecal sample was sensitive enough, because that's how they diagnosed COVID in the gorillas in San Diego Wild Animal Park and Zoo Atlanta and Prague Zoo. We quickly made sure that people have hand washing stations. They use them. They put on masks if they're close to a gorilla. There was a lot of no open defecation and all of that. And we joined the Uganda Ministry of Health COVID Task Force. We're the only conservation NGO on the task force, and we're considered essential workers all through the pandemic. We trained our 270 village health and conservation teams and 119 gorilla guardians, the Hugos, in COVID-19 mitigation. But we did have a setback. This gorilla was killed by a hungry bushmeat poacher, because suddenly when tourism disappeared overnight, people had nothing to eat. And they were going into the forest to poach because they couldn't get tourism money to buy food. So he was caught and he was put in jail for 11 years. And then we started to meet the poachers' wives. It suddenly became an urgent activity to meet the reformed poachers. And we checked on Rafiki's group, Rafika having been killed. It was really sad. The group dropped from 17 to 11. And this particular ranger, Porter, was wearing a mask saying in memory of Rafiki. So the community was very upset that Rafiki had been killed. And then we realized we're going to have more gorillas getting killed if we don't help them in other ways. So we added food security to our One Health model. we started to provide fast-growing seedlings to households around the park. With the first 1,000 in November 2020, people told us majority of us are poaching because we're hungry. So we started to do this, and we're doing this beyond the pandemic with support from National Geographic Wildlife Conservation Network and other donors. And the poacher's wife was one of the first beneficiaries. She was 22 with 3 children under the age of 3 and very poor. So we made sure our village health and conservation teams support her. One thing that we also started doing was getting a model household where we get 12 ideal indicators. And if you have 4 out of 12, you're red home. If you have 5 to 8, you're amber. If you have 8 to 12, you're green. And we did find that in spite of doing this work for a while, only 23% of our homes were green. So this was a new way of measuring how a household is improving. And within 3 years, it had tripled. So we're really excited about that. Responsible tourism to the Great Apes is something that I feel very strongly about, because actually the greatest threat to the gorillas is not only the local communities, but the tourists who visit them every day. And today I spoke to the tourists before we went to the gorillas, and I said to them, look, you may be wondering why the ranger said you have to wear a mask. During the pandemic, gorillas didn't have respiratory disease, much less flu, because everybody was wearing masks. And this was mainly in the Virungas, where it's a high altitude. And so I said, because you put on masks, you're not only protecting gorillas from COVID, but also flu and other diseases. And they nodded their heads, they fully understood it. Another thing we tell tourists is that it's important for them to buy a craft from the community, help a community member, because when a local community member meets a gorilla, they're much less likely to poach. So we launched a policy brief on responsible tourism to great apes for the 13 countries in Africa with great ape tourism, and it's both in English and French, and we did it with International Gorilla Conservation Program. We've hosted students from different places, and one of them came to study the role of women in conservation. We're excited that now 30% of the rangers are female. When I first started out in 96, none of them were female. Today we had a female tracker holding a gun, which is fantastic. So women now know that they can become rangers, and it's not just a job for men. And some of our gorilla guardians are women. It's very new, because they used to think women will faint if they see a gorilla. I don't know what they thought about me, but anyway, so we're pleased that engaging women in conservation is helping. And I'm also on the Leadership Council for Women for the Environment Africa, where we are mentoring women to realize their leadership potential. In 2016, we started the African Primatological Society. I became the vice president, and in 2019, we hosted many people in Entebbe. We're trying to build African leadership in primate research and conservation. The US ambassador visited us in 2023. She wanted to visit the gorillas. We took her to the gorillas, and she became a big advocate for mask wearing. We took the patron, the Queen of Uganda, to the gorillas for the second time when we officially opened the Gorilla Health and Community Conservation Center. And now more and more Ugandans want to visit the gorillas, which is great. And she's also an advocate for mask wearing. I took my mother to meet the gorillas in 2000 when I was in my last year at the Wildlife Authority. She was 70 then. She felt that they were just gentle vegetarian giants living in a big salad bowl. She's always supported me to do what I want to do. Sadly, she passed on in August. And just today when I was with the gorillas in the forest, I felt like my mom was telling me, just keep going. She was very proud of me. She was one of the first female politicians in the country and also wrote an autobiography, My Life is Butter Weaving. Our son Tendo became an expert on COVID-19 and gorillas during the pandemic and wrote this article. And when he turned 15, we finally took him to see the gorillas, which was great. And his older brother Indigo wrote a book, Zookeeper for a Week, and it won a Children's Book Award in America. We are doing a lot with getting kids to collect rubbish, and National Geographic Society funded this first STEM program, which we did together with Global Green STEM. Actually, currently, right now, we're with a photographer from Nat Geo who is taking photos of me for the magazine later in the year, in October, together with he's also featuring 2 other explorers. And so we took him to see that project. And we just found that just getting people to have livestock stops them poaching. It is one of the poorest schools around the park that we've supported. I was really excited to become a UNEP Champion of the Earth in 2021 and to be on the BBC 100 Women list among the climate pioneers, and to get an honorary doctorate from my old vet school in 2023. In that same year, I published a memoir and charter about my conservation journey, working with gorillas. And we're very excited that Dr. Jane Goodall wrote the foreword. May she rest in peace. And I hope you get a chance to read it. I know we did a book talk in Tufts, which was organized by Dr. Joanne and Dr. Felicia Nata. So this is the last thing I'm going to talk about is the number of mountain gorillas is growing, but the space isn't growing. And this is something that is continuing. And so and this is happening all the time. The gorillas are eating eucalyptus and continuing to eat people's banana plants and causing a lot of tension. So we've spoken to communities in this area, and 277 of them have signed free, prior, and informed consent that they want to sell their land and which we want to buy for the public good. It's really around this area, the neck of the park. And we're hoping that we'll be able to expand Bwindi. It's a lot of money. It's as much as $3 million for the first phase. But because land is so expensive, because they could sell it to a lodge and would give them that much money. But if they sell it to a lodge, they will lock the gorillas in. I would love you to get involved in our work. Follow us on social media, spread the word about our work, sign up for our newsletter, come and do research, just like other students have done. It's a student from India who came after I spoke at the SSC Bangalore event. And we want to continue to expand our One Health model across Africa. You can buy the coffee and buy the book. They're all available in America. CNN recently featured our work last year, a documentary called Kings of the Forest, which talks about our One Health approach and how we're sustaining tourism through coffee and very much what I've talked about in the presentation. Well, thank you so much. And we look forward to maybe hosting some of you to do studies with us. There's lots of things we'd love to study. Some of them are One Health specific, some of them are conservation related, but they're all interconnected, and some are livelihood issues. And I'm looking forward to your questions. Thank you.
Well, that was wonderful. Thank you very, very much. So at this point, we'd like to open it up to questions. And I see that Bernie has his hand up right away.
No, I was clapping.
Oh, you're clapping. But do you have a question, Bernie?
Not necessarily. I mean, all of this is just, it's fantastic. I mean, my question is, well, maybe there is a question. You've done so much, Dr. Gladys, and I wonder, your approach seems to be, scaling from one project to the next. Did you envision it would grow this big when you started your organization, that you would be doing all of this? Or has it been just, identifying all of these species as you went along and trying to find solutions for specific problems?
I would say that it's a great question. We started out with thinking we're just going to look at zoonotic disease. But I quickly learned, and even when we got support from US Fish and Wildlife Service at one point, because we wanted to expand the village health and conservation team approach to the Batwa, the pygmies who used to live in the forest. And they came over and said to me, look, you have to start looking at the gorillas, not just as a species, but a habitat. Then they gave us the funding. So many different people, how to, improve on what we're doing. We're learning from the donors, we're learning from our partners, we're learning from the community, as you saw in my presentation, from the government. And each time we keep expanding. So no, I didn't expect it to be us to have done this much and to have been this big, but it has been a real One Health journey. And I realized that One Health goes beyond just preventing zoonotic disease, which a lot of vets just focus on only, but it's actually more than that. And if we want the medical community and the conservation community to get more interested in One Health, we have to look at it more holistically. So for example, some of my mentors high up in conservation said, I love the family planning piece. Now that makes sense because the national parks are disappearing because people have too many children. But also when you have children you can afford, just a few, not 10, as opposed from 10, we reduced the family size from 10 to 4 through our work, which we're very excited about. The district health officer applauded us. It means that everyone can go to school, everyone can get a job. They don't have to enter the forest to poach or collect firewood, and you've broken the poverty cycle. So it's not, you don't tell them that, oh, you're having too many kids, it's bad for the forest. But you say, when you have enough kids, you have the kids you can manage, it's good for you, it's good for the forest, it's good for the gorillas. And that, a lot of conservationists connect to that. So everybody connects to different things. But definitely, of course, the medical people are like, I always make them laugh when I say that the gorillas are better than us at family planning because they have a baby once every 4.5 years, and the chimps as well, once every 5 years. They plan, they're much better than us at birth spacing. And they're logical about it because by the time the new one is born, the older one can look after the younger one. And they always laugh a lot. They think, how can we learn from animals? But yes, we can. They're much more logical than us. So, so it's like, it's been an exciting journey and it's continuing to grow. And the alternative livelihoods has been great. And the food security with the ready to grow, that came about, we learned it from a development NGO, Raising the Village, and Mulago Foundation. I was a fellow I'm a Mulago Foundation fellow. They said, why don't you try it? You're in COVID, people are starving, so we tried it and it's worked.
One thing I'd like to ask and connect up to something that Fred Kuntz said in his presentation 2 weeks ago is that that everyone has an understanding, an intuitive understanding of what health is. It may not be a complete understanding, but they have a sense of One Health or what health is. And because of that, talking about things, framing things in terms of One Health opens up doors. At least that's been the experience that Fred Kuntz has had. Is that a similar experience to yours?
Yes, it does. It is a similar experience because a very important component of One Health is community. And once you talk about community health and well-being has to improve in order for the wildlife to do well. And if the wildlife is not doing well, people won't do well. Zoonotic disease goes both directions. People can get sick by eating bushmeat, with Ebola, anthrax, and all of that. And COVID pandemic, I would say, really, people started to understand our model. And I'm sure a lot of vets have said One Health came into maturity during the COVID pandemic. For suddenly people are like, oh, it's not, because at one point, one of our conservation donors was like, but is disease the most important issue for gorillas? Is the most important issue for conservation? But when the pandemic came along, yes, it was. Not only did it make the wildlife sick or the people sick, but suddenly the economies went down because no one could do it. And we had a mini version of it when there's Ebola in Uganda, no tourists came, they canceled their permits. There's anthrax in Queen Elizabeth National Park, tourists are scared to go there. But now COVID was a huger version of all of that. So it also becomes an economic issue and even a climate change issue. So I think One Health actually opens up doors because it shows it's not just the health of the people. It's also the health of the animals, the health of the environment. And there's so many other things involved. And it connects to all these other things. So it does open up doors.
That's interesting. So let me follow up on that. And this is specifically on an ethics question. Being an ethicist, I'm thinking about it in that way. Caring about the well-being of the community, caring about the well-being of gorillas or habitat presumes a kind of ethical openness.
Yes.
And do you feel that One Health helps tap into that in a way where a discussion simply of economics or ecology might obscure that sort of care that health can bring to the fore? That when you speak about One Health, are you directly accessing people's sort of larger moral sensibilities and giving them permission to talk about it?
Yes, we've definitely found that because two controversial topics I found was conservation and family planning. It's the same in America.
Yeah, very much so, especially in this America.
But then when you bring in health, you make people feel, actually, you care about me. So when we started improving the health of the people, the ranger actually said to me, one of the older rangers who I trained early on when I was in the Wildlife Authority, he said to me that I'm so good that you're starting this NGO because people need their health improved. And so we found that when we started improving community health, people felt, actually, you don't only care about the gorillas and the forest, you also care about me because healthcare is a basic human need and a basic human right. Then they started to care more about the gorillas and the forest because you've shown them, because a lot of conservationists come across as the wildlife is more important than the people. But
Mm,
with you bring in One Health, they're like, no, we also shows that the people are as equally important as the wildlife. So I think it really, there's that ethical part that really comes in. And
mm,
yes, you're right. One Health makes the ethical argument come out more clearly. It
mm.
really does.
Okay,
Mhm.
thank you. Joanne, you have a question.
Yeah, I just want to say that that whole idea of caring about human communities and not making them uh, opponents and not, not sort of making them invested because it's in their interest to be involved in conservation, whether it's a species or habitat. That this is what Dr. Gladys has done and Lawrence have done here is, at least in my estimation, the most brilliant example of One Health. I'm sad to say that a lot of One Health initiatives and programs don't do it to this extent, and they make it. It's often about there's bad animals are bringing us bad diseases, and so therefore we have to do something about the animals. And I would really, really, really love to see the model that uh, Dr. Gladys and Lawrence and others have developed and implemented here. I would love to see lessons learned from that to be implemented in other types of programs. I would really, I don't think we do this enough. I think there are very few examples such as this, and that would be my interest. Would be say, how can we implement these lessons, which are incredible lessons? How can we implement them with the ultimate goal of improving habitat, conserving habitat, and conserving species? So that's my goal. I think One Health, at least as it's being researched and implemented now, has a long way to go. But I think this particular model shows us the way.
So thank you so much, Joanne.
You know
And
how I
actually,
feel.
thank you for being a fan. Joanne's one of our biggest fans.
I am.
And I was really honored that I'm going to be speaking at the Squall Wild Forum towards the end of this month on 22nd April. And there's a session on One Health this year, and I'll be one of the speakers. So I'm really excited. It's more of a development audience, and but it's great that there's a session on One Health. They realize it's important.
Absolutely.
And hopefully I'll get them to, I'll try and bring in all the aspects, as you said, bring in all the different aspects, of One Health. And, we shouldn't only just talk about the zoonotic disease, but everything else, but let them see that it's beneficial for people and animals and the planet. So yeah, hopefully it will go well and we'll get more support.
Yeah, I mean, to me, starting from a small project with a zoonotic disease, scabies, and then expanding to this is absolutely remarkable. But I think, the goal that you originally started with was conserving these mountain gorilla species, and you have accomplished that. And I think it's remarkable.
I think there's a benefit to having a kind of interdisciplinary, not to go on the transdisciplinary piece here, but an interdisciplinary sense of the connection of things theoretically, because then you see on the ground the connections between family planning, between livelihood and other things like that. So it's a One Health becomes a way of understanding the world that opens you up to those interconnections and thus lets you do very practical things that helps promote the well-being in many ways. It's wonderful. It's wonderful. Fred, you're popping on. I think you want to say something.
Yeah, well, first of all, just thank you so much. What a presentation, what a project. And Rob Liddell's on the phone. I think Lisa dropped off, but it does remind me a lot about their project in Papua New Guinea. And the two of you talking more, I think, would be fantastic because there's so many shared lessons. But what I was going to say is, well, a couple of things, but again, Gladys, you're a great reminder of how important field veterinarians have been in the One Health concept growing. And I think that's because it made sort of that easy first connection between zoonotic diseases and animal and human health. They're sort of more naturally. To me, the big challenge moving forward is to really kind of redefine that third element. Gladys, you remember back when you were starting all this, and conservation medicine emphasized more human health, animal health, and ecological health. So I was wondering if you had any ideas. Still the ecological
Yes.
health is a hard, things like habitat fragmentation. You talked about your two populations, the need for
Mhm.
corridors. Ecological health. What really is it? And then how do we get people? Once we get this dialogue really going and the community understanding the linkage, what are the what are the mechanisms? What are the messages? What are the activities about ecological health that we can expand One Health to really what I think at least conservation medicine originally had hoped for? Any thoughts there?
Yeah, that's a hard question and a difficult one, but I think it's very, very important. And where we can bring in the ecological health is the whole climate issue. A
Yeah.
lot of people ask me, is climate change affecting the gorillas? Is affecting, and it is, but we're studying it and we want to study it a lot more. We want to really get into it a lot more. So I'm partnering with, professors in nutritional ecology, and we're trying to look to see whether a gorilla is cooperating because maybe the food that they're eating inside the park is reducing in quality,
Yep.
and that is leading them to go out. And so we're trying to expand what we're doing. We're trying to add a climate lens onto everything that we're doing, because we keep being asked that question, and I think we now need to do it more. We really need to study it systematically. Of course, it's increasing. We believe it's increasing infectious diseases and potential for zoonotic spillover. But what about the issue of the habitat of the gorillas? Not only is the space reducing, but even the quality of the habitat could be being changed. And what can we do to prevent this? And how can we, make things a lot better? But if, for example, the thing about cooperating, do we tell people now don't plant this particular tree in your garden because the gorillas are going to get attracted to it? And I was surprised that now there's something called Mauritius thorn that has been used for a long time to prevent crop raiding. Suddenly, the gorillas are now beginning to eat it. They told me that. I was like, "What?" You know what I mean? So there's a lot to learn there as well. The whole ecological health field, I think, needs to catch up with the rest. But I think if we work very closely with conservation biologists, I think it will really catch up. But it's a very important aspect of One Health. That's the habitat has to be healthy as well for the species to do well and for the people to do well as well. Yeah, but one thing we are telling people, plant trees, plant indigenous trees, less of the ones that, eucalyptus soaks up, is a very thirsty tree and it drains the soils. And so all of that is coming into what we talk to people about. Proper soil and water conservation. Even with the coffee farmers, there's a commitment to zero deforestation, but they have to plant shade trees, do proper soil and water conservation. They'll get more coffee, better quality. But all of that is just trying to reduce pressure on the park. And when people plant trees, every quarter, like every person plants about 30 trees in a year. And now we're engaging over 10,000 people. So that's like over 300,000 trees are now being planted by these community members, which means it's good for the climate, but also means they don't have to enter the forest for firewood. And while they're there, maybe poach an animal too, and everything starts getting worse. So we're trying to find different ways to look at all these issues.
Great.
Wow. I want to be respectful of your time. So maybe do we have one or two last questions before we wrap up today? Yes, SJ, it's nice to see you here.
Hi, Bill, you too. Yeah, I don't really have a question. I just wanted to say thank you, Dr. Gladys. I feel like I have been following the plight of the mountain gorilla the entirety of my life ever since I was a young child. And this is the most hopeful I have felt in a very long time. This is very good news. So thank you for all of the work that you and your team do. It's fabulous.
Oh, thank you so much. And I hope you enjoy my book. And actually, going back to ecological health, we are doing water sampling, looking for pathogens in the water, especially the waterborne pathogens. So that's as far as we went with ecological health, but we want to keep developing it and now putting in climate and nutrition and other things, nutritional ecology and other things. But But please come and visit. I'm really waiting
Yes.
for you guys to come over and just see the One Health work in action and do joint studies with us. We're very open to joint studies, joint publications, because there's so many, every time you're here, there's so many things you can do. There's so much need and there's so many questions to be answered to make it better. But other places, working with other partners, but also to improve on what we're doing at Bwindi. Kind of use Bwindi as a test case for One Health and then see what we can scale up to other places.
That's great. That's great. That's a wonderful note to wrap up on. Well, Dr. Gladys Kalema-Zikusoka, thank you so much. Thank you so much, Lawrence Zikusoka, for also of supporting this talk with all the resources that you've shared in the chat for our listeners. And I want to thank you all for being here on behalf of the Society for Conservation Biology North America, as well as PanWorks. Just so you know, we're a professional organization working for the benefit of biodiversity on the Society for Conservation Biology side, and PanWorks is an ethics think tank working for the benefit of animals. And we're delighted that you joined us today. So thank you. We'll wrap it up.
Thank you so much, everybody, and look forward to hosting you in Bwindi one day.
Thank you.
PanThinks is a production of PanWorks, an ethics, science, and policy think tank for the well-being of animals. It is edited and produced by Gary Shear with the help of Bill Lynn. To learn more about PanWorks, visit our website at panworks.io. To donate to our work, please visit our support page on our website. Until next time, this is PanWorks, bringing ethics to life.